I rise today in support of the McConnell Amendment to the FAA reauthorization bill. What we have this afternoon actually is an opportunity to show the American people that we are listening to them. The American people want the Obamacare law, the Affordable Health Care law as it's known, to be repealed and replaced with something less expensive and something workable. Polls show this. The individuals that we talk to when we go home tell us this, and this vote will be an opportunity for us to show them that we are listening. Now, I've heard some of my colleagues come to the floor this week and suggest that this massive 2,000-page tax-increasing, job-killing bill is, in fact, just what we need. I would suggest that there are a number of facts that indicate otherwise. The other side would have you believe that without this health care law, this country is going to fall off the tracks and the world will virtually come to an end. And they try to cite one or two popular proposals that are in this law, which of course could be enacted after repeal, practically by unanimous consent, and ignore the fatal flaws in the law. The former Speaker of the House, Nancy Pelosi, during the consideration of this act in the House and Senate, famously told a grassroots group that had come to Washington, D.C., we need to hurry up and pass the bill so you can find out what's in it. Well, indeed, since the passage and signing into law of Obamacare, the American people every day are finding out something new that is in the bill that they don't like. And as a matter of fact, it turns out that members of the House and Senate who voted for Obamacare also did not know precisely what was in the bill and certainly did not anticipate the ramifications of this massive, ill-advised law. Under the new law, it is absolutely a fact, and we know this, that Medicare will face over $500 billion in cuts. And senior citizens have a right to be concerned. Future senior citizens have a right to be concerned about these cuts. They include $155 billion from hospitals, $202 billion from Medicare Advantage, $15 billion from nursing homes, $40 billion from home health agencies, and $7 billion from hospice. Cuts from these federal expenditures in Medicare to pay for the new Obamacare legislation. Everyone agrees that Medicare needs to be made more solvent, and we need to work on Medicare. But these reckless cuts will only make Medicare's problems worse. Another thing Americans have found out about this affordable health care law that is being implemented even as we speak is that the law falls short of the president's goal of controlling runaway costs, and in fact raises projected spending. Last week in his State of the Union address, President Obama said the health insurance law we passed last year will slow these rising costs. This is simply not true. And to support my assertion that it is not true, I would cite the president's own actuary. CMS reports that, in fact, spending will be increased by about 1% over what it would have been over 10 years. That increase could get bigger, of course, the report points out, since the Medicare cuts that I've already pointed out may be unrealistic and politically unsustainable, according to the report. CMS says that overall national health expenditures under the Health Reform Act would increase by a total of $311 billion, and that health expenditures will be 21% of the gross domestic product by the year 2019. But it's not just the government bean counters that are worried. Here's what the National Federation of Independent Business said. Small business owners everywhere are rightfully concerned that the unconstitutional new mandates, countless rules, and new taxes in the health care law will devastate their business and their ability to create jobs. That's the National Federation of Independent Business. National Association of Manufacturers says that manufacturers remain adamantly opposed to the employer mandates and to the Medicare hospital insurance tax increases. These employers are faced with incorporating the first round of health care changes and are grappling, having difficulty doing so, with how to comply with the long list of new rules. These are not scare tactics. These are not unwarranted fears by a confused public. These are people who work with health care every day and are telling us that this Congress has made a mistake. In fact, there are already real consequences of this health care reform law. Abbott Laboratories said it is cutting about 1,900 jobs. It's just a fact. The job cuts come, quote, in response to changes in the healthcare industry, including U.S. healthcare reform and the changing regulatory environment, unquote. That is simply a fact. It's not conjecture. Blue Shield of California recently stunned individual policyholders with a huge rate increase effective March 1st, seeking cumulative hikes of as much as 59% in premiums for tens of thousands of their customers. This San Francisco-based Blue Shield said the increases were the result of fast-rising health care costs and other expenses relating to the new health care laws. Again, just a fact, Madam President. It's also an absolute certainty that state taxes are going to go up, and they're going to go up big time, unless we repeal this health reform law. In my state of Mississippi, the legislation will cost the state $1.7 billion over 10 years, including $443 million in year 10 alone. From fiscal year 2014 to fiscal year 2020, the massive expansion of Medicaid will cost Mississippi taxpayers $225 to $250 million extra each year. Our governor, one of the staunchest opponents of tax hikes that I have ever heard of, has stated that this law will certainly force the state of Mississippi to increase their taxes unless it is repealed. Again, these costs are simply facts. They result from the mandate. Madam President, there's also bipartisan opposition to this law. We didn't see much bipartisan support for its repeal in the other body, and I was disappointed by that. But when you get out to the public, when you get out off of Capitol Hill and out to individuals, it's not a Republican issue, it's not a Democrat issue, it is a bipartisan American opposition to this law. And I have repeatedly quoted former Governor Phil Bredesen, a Democrat of Tennessee, someone who ran as a Democrat in his state successfully twice and ran as the standard bearer for his party 3 times, a loyal Democrat, who of course called this law the mother of all unfunded mandates. But after the law was enacted, he wrote an op-ed in the Wall Street Journal, October 21st, 2010, and at this point, Madam President, I'll ask that this op-ed be included in the record at this point.
Without objection.
And among other things, Governor Bredesen, who's still governor at the time, said our federal deficit is already at unsustainable levels, and most Americans understand we can ill afford another entitlement program that adds substantially to it. But our recent health health reform has created a situation where there are strong economic incentives for employers to drop health care coverage altogether. The consequence will be to drive many more people than projected, and with them much greater cost, into the reform's federally subsidized system. The Democratic elected governor of Tennessee criticizing this act and pointing out other facts that are wrong. And in his subsequent book on the subject, Phil Bredesen also criticizes the health care law, saying it will cause deficits to go up, costs to continue increasing, employers to drop coverage, state costs to increase, governments to grow, and will make our current problems worse. Obamacare is not what the doctor ordered, according to Governor Bredesen. My time is limited. I could go on, and members of the Senate and House could and will go on as we face this issue if we don't win it today. The facts are there. This is a terribly flawed piece of legislation. Facts are stubborn things, and the consequences have already started to mount up. Opposition is strong. Support for repeal is strong and bipartisan. And for those reasons, I will vote in favor of the McConnell Amendment when we consider it later on today.
Madam President.